My name is Seamus Murphy, and I'm a consultant gastroenterologist at the Hillsborough private clinic in Hillsborough, County Down. When I was going through medical training, I wanted to get a specialty where I could see patients and make diagnoses by taking a history and examining them, but also have the ability to perform a procedure or have a skill, a practical skill. A gastroenterology gives me that variety where I can see a patient and come up with an idea as to what I think may be wrong, but then perform the gastroscopy or the colonoscopy myself and make a diagnosis. So I find that very satisfying. I think that when patients come to me, the majority of them are worried. They have symptoms, and even though those symptoms often don't indicate anything serious or sinister, the patients are concerned because they've maybe talked to relatives or some neighbors or checked online and have maybe fear about the worst possible diagnosis. So my ability after the history and the examination and then being able to perform investigations, the ability to be able to reassure them and make a positive diagnosis and then advise them about a treatment plan is something that I find very rewarding. Patients, from the feedback I've received, value the fact that I can listen to their concerns and then speak to them in plain English and explain what I think is going on and why they're getting symptoms or the complaints that they have, and been able to investigate them sensibly and appropriately, and then feedback at all times about what the plan is and what we should do. Whenever I trained in New York City, one of the senior gastroenterologists that I had the opportunity to sit in at his clinic, he always started the consultation with, "So tell me the story." And I thought that was a great general opening line, and then encourage the patients to tell their story in their own words. So I tend to open the conversation at every consultation, tell me the story. And I find it's so open-ended that it lets the patients then focus immediately on what they perceive to be important.